My name is Nancy Sayer. I'm the designated nurse for looked after children for Kent. My main responsibility is to provide expert clinical advice to the clinical commissioning groups on the health needs of looked after children, and that includes unaccompanied asylum seeking children. So when I talk to the clinical commissioning groups that I work with and the commissioners that I work with, it's about making sure that we have thought about the additional needs of UASC in our population of looked after children. Having a real focus on making sure that we've commissioned enough capacity in certain areas of the services that we commission is vital. By bringing all these young people into our communities, the herd immunity that we had gained from our national programme was being affected, and there was a potential that we might have an outbreak of disease if we were not able to vaccinate the young people coming through. This was more complicated than I expected it to be, as the NHS commissioning arrangements for vaccinations is fragmented, with Public Health commissioning some vaccinations and NHS England others. And we had to find GP practices that would provide that on an individual basis. A further difficulty I found was TB screening. We need to TB screen all of these young people coming through, as we've got unknown journey history. The national protocol didn't take into account the needs of unaccompanied asylum-seeking children. We now have a direct referral system in Kent for these young people, which has made life a lot easier and meant that we can support those young people. In addition to those two challenges, one of the other things that we've come across that's been quite difficult to sort out is the need for dental treatment and optical screening. Vision testing for these young people needs to be done in community practices. And again, their status is a looked after child, but 16 to 18-year-olds not in education are not entitled to have vision tests, and that's unless they have a certain type of certificate. And that again has been quite difficult for us to sort out. Not only has it been around their entitlement, but also the need to have interpreters available for the treatment. And the numbers of unaccompanied children has increased, but the numbers of interpreters available has remained the same. So that's been an additional challenge for us. And it's something that you need to bear in mind when you're looking at services for these young people in the future. If we don't work as a team, or you can't provide the services that are required. Understanding the health needs of our children has been vital, and reading what Public Health have provided for us will inform any area in the country of the type of health needs that they're going to come across. And the other thing that I think is really important is to not misunderstand the euphoria that young people feel when they get here, because they are so excited and so relieved to actually have made the end point of their journey. It actually masks deeper holistic health needs, and that includes emotional and mental health. And it's really important that you revisit that several months after they arrive into your care, because you will only get a clear picture of their needs once they've settled into the routine of their placement. And I think the last thing is don't dismiss them if you think they're okay, because often that they've buried a lot of the trauma inside them, and that will come out later. The earlier we can try and help them understand we can make a difference to the way they think and feel about their past, the easier they'll find life going forward. We don't always get thanked in the NHS for the work we do, but when we get thanked by the people that we are working for, it makes a huge difference, and it makes you stronger and more determined to carry on making that difference to young people's lives. Last September, they made me a present for my birthday, and it was so unexpected it brought tears to my eyes. They had created for me my initials as bookends, and then they gave me a wooden box that they'd made for me to keep keepsakes in. And they'd done that as part of their art therapy group. And it was so touching that they thought that much of me that they would produce something that I could then keep and remember them by. And I found that amazing. I've been very lucky to have the opportunity to work not only with the team that we've built up to meet the health needs of these young people, but also the young people themselves. For whatever reason they're here, we just need to try and make sure that we can do our best for them.